Okay, so this video is going to be on the top 10 hacks to make dentistry more efficient and to get your procedures done and just your overall function in the office done more quickly. I've kind of divided this into two different sections. One's going to be on products and the other one's going to be on technique. Let's start with products because I know that's what everyone likes the most. So what I have found when trying to put in implants, especially implant restorative, meaning taking off healing abutments and putting in restorative abutments, instead of using a finger driver or using the regular torque wrench that comes with the kit, Salvin makes a kind of a twist. The handle twists to do this a torque driver for an implant for just backing those things out, and it has a dial-in torque value, so you can dial in what you need, and you just keep turning and turning until you hit the fail, and then it clicks, and there you are. You know you're at the right amount. What I like about that is because it just comes right out of the patient's mouth, and you're just twisting. You're not having to crank back and forth, and you don't have to go back with the finger driver, especially the further back you go. It's hard to fiddle with that, plus a cover screw or a healing abutment all at the same time. So this little twist thing is a lot quicker, and I'd also say a lot safer. Second product is loops, specifically loops that have a light on them. I use the ones by Surgitel. They just seem to work the best for me. The amount of declination in the actual inserts, the actual loops themselves, seems to work really well for my back and neck, and it just makes procedures go by so much quicker when you can actually see what you're doing. All right, product number 3, a simple little thing, a stock of backup burrs that are in the room. I typically have my magnetic set of my burrs I have set up for your typical restorative procedures, but sometimes I need something that's a little bit different, or maybe I dropped one, or I have one that's a little bit dull, and so I need to have a backup stock right there instead of having the assistant get up and run to sterilization and get them. And so you can see in this picture, this is kind of the backup stock that I have. I actually have 2 different burr sets, and we just have this duplicated throughout each office. And I have just a piece of red tape and a piece of black tape just to kind of indicate the differences between the two, so that the assistants can have these already pre-set up and they're in my operatory, so it's just ready to go. Next thing is when placing composite restorations, the kind of bonding system that I like to use is the Clear Fill Universal Bond Quick. What I like a lot about this product is it's not very technique sensitive, which means you can apply it to the tooth and you just need to scrub for a moment or two and then just start air drying. Some of the systems require you to actually brush the material on for 20 seconds. Now 20 seconds is a long time when you're having to do a series of fillings, and I think just sitting there for 20 seconds, I think if you're probably like most dentists, you just don't have the patience to sit there and wait for 20 seconds while you're scrubbing something. It seems like it should work within the first few seconds. And the nice thing about the Clear Fill Universal Quick is that it just takes a couple of seconds to put on. Actually, if you read the instructions, it says no need to wait, just air thin, and you want to air thin for at least 5 seconds. And again, I should mention, because this is mentioned in a different video, is that when you're blowing air, you're not air thinning anything, you're actually evaporating the solvent, so you can leave behind truly just what you need. The solvent carries the actual bonding material to the tooth, and what you need to do is evaporate that off. So that's what that 5 seconds is for. Next thing is, this is pretty simple. I use compules for my composite, and I like to have flowable and I like to have regular. Have both guns in the room, so you don't have to switch out your flowable, then put in your regular. You just have 2 guns with each one of those 2 composites ready to go. It seems like it's pretty simple, but I have found that some dentists don't do it that way. They just switch it out every single time. Let's see what's next. Well, no, it's next. It's also going to be a mixture of 2 things. It's going to be a product and also a technique. I like using for my zirconia crowns, or occasionally a metal crown if it comes in, would be Reliex plus luting agent or luting cement. What that does, it's your typical, you just mix it, it's a clicker, it comes out, paste, mix, so it's you don't have an even amount. You mix it, and when you apply it, you put it on, it has a light curing component. Now it's not your typical light cure resin, it's actually a light cure. It helps initiate the set. What I like about that is that you can put it in, have the patient bite on a cotton, zap it with the light from the buccal, have them open, take the cotton out, go from the lingual, go another beep, which is about 6 or 7 seconds, go from the occlusal, and then at that point, after you've done those 6 or 7 beeps, 3 of those total, you're talking what, 20 seconds or so, you can pick up your instrument and immediately start carving off of the, the excess around the margin. And then That's what I like about the product. Now it comes down to the technique, it was like I just kind of described, but have your assistant in there and have you as the dentist in there actually helping with the cleanup. Some dentists just have the patient bite on the gauze and they walk out the room and have the assistant wait for 2 minutes and then actually remove the cement. I find that if I stay in the room, have the patient bite and go through that curing thing I just described, and then have the assistant hold with a plug or the occlusal of the crown, I can go with the floss and get the mesial, get the distal, clean it out, and then I'm out of there. It takes a little bit more of my time, but it decreases the overall time the patient is in the chair. And if you're trying to turn chairs just that little bit quicker, that makes it easier. Plus, the risk you run if you leave it for 2 minutes and have the assistant in there is by that time the cement is set up, and sometimes they have to chisel away at it, and I'd say 1 out of 10 times, 1 out of 20 times, they're calling me back in after they've worked on it for about 5 minutes. Now the stuff is rock hard, and they can't get it out interproximally, and now you end up spending a lot of time trying to fix that. So that's a change in your technique. If you're just, again, don't have them just bite on the gauze and leave the room. Stay in the room and help clean that thing up. It takes about 45 seconds of your time to do it, and it's going to save the overall appointment time into the future. Okay, now let's move on to some technique things that you can do. When you're going in to do a series of fillings, let's just say, and you're going to use like a couple different types of burrs, use one burr, prep the teeth, then switch to whatever your next burr is in the sequence and prep all the teeth. Just do that. Don't just do one tooth, go through a series of burrs, and then go to the next tooth and start over with the other series of burrs. Do it all the way through. So the less time you're switching out in your hand, the burrs, the faster it's going to go. Also, when it comes to doing fillings, let's say you're doing one on the left and one on the right, what you want to do is you can prep both of them like I just explained, go through your series of burrs, prep everything. But when it comes time to do the actual placement of the filling, place the filling, let's just say here on the left side, and finish it off and check the occlusion and get the occlusion dialed in there first. Then go over to the other side. Okay. If you do both of the, do one side and then you do the other, and then you start checking the occlusion, you're going to be bouncing from left to right to try to figure out how to dial in the bite just right. So if you get one done all the way, then go to the other side. As a side note, most of the bonding agents have about 5 to 10 minutes of time after you dispense it into the well, before that starts to evaporate out, and you'll have to wipe it off and get some more. So if you're doing this thing where you're doing the left and the right and you're doing the fillings like I just explained, you may have to wipe out your bonding agent before you go on to the other side, just in case too much time has gone by. Let's see what's next. When you're doing a composite buildup, you're getting ready to do crown prep, okay? Now the tooth you're on has let's just say an old amalgam filling, an MOD filling. You lift out that amalgam filling, you clean out the decay. In our office, we snap a picture before we do the buildup, so we can show what the tooth looked like prior to placing the buildup. But now we're at the buildup stage. Put a disposable matrix, Ultradent makes one, put it over the tooth, tighten it down, go through your etch, your rinse, all your different bonding steps, again, using the clear fill. Put in your composite, but when you're packing the composite, when you get to the mesial and the distal, as you're packing it down vertically, what you do is take any kind of small instrument like a cord placer, go right along that wall of the matrix on the mesial and right along on the distal, and kind of pull some of that composite away from the matrix and then cure. What you've just done is you've helped eliminate that amount of time you're going to have to go spend back and forth trying to prep the mesial and the distal after you've taken off the band, you're getting ready to prep the tooth. If you've already kind of built in that part of the prep with your build-up design, you're going to save not only time, but you're also going to decrease the risk of actually scuffing the neighboring tooth. Next up is have the assistant get all of the preliminary things done for a crown. Have them do that after you give the anesthetic. We've had some temporary assistants that have come through the office, and they take the x-ray, they take the preliminary impression, they get the shade, and then they call me in to do the anesthetic. Do the anesthetic first, and then while the patient is getting numb, that's when you can go get all those other preliminary things. Is while you're waiting for the patient, you're kind of overlapping. While you're waiting for that, you're getting these other things done. So that's kind of helps speed things up when it comes to crowns. And lastly, and this may seem like kind of a simple thing, but if in your lab, if you have cabinets and the cabinets have got doors, remove the doors like you can see in this picture. When you take the doors off, it looks not as clean and neat, but as long as this isn't something that's being seen by patients, this just simply allows you open access to get to what you need. There's no point in going around your lab opening and showing all these doors trying to find a case. I know you probably have things organized, but sometimes you just want to walk in and see if a case is ready to go. And if all the doors are off, you can just look and you can just go. Plus it gives you an idea of a case that may have been up there for a while that needs to be addressed. But if it's always closed, you always forget that it's there. But doors are open, it gives you easy access. So those are my tips and tricks for the top 10 hacks that, at least I'm sorry, there was 11. I gave you 11 hacks in dentistry that kind of helps make things go smoother, safer, and just overall more enjoyable. All right, take care.